I am Dr. Yogiraj. I am consultant dermatologist and hair transplant surgeon. I work in both the Bengaluru branch as well as the Trivandrum branch of Dr.Yogiraj Centre for Dermatology and Cosmetology. Now I'll be talking today about the topic of hair transplantation. Now when we sit in a dermatology OPD, around 30% of our patients is hair patients. They come to us telling, doctor, I'm becoming bald because of change in water, stress levels, dietary habits or dandruff in the hair. But does it really cause balding? No, it doesn't. Because when hair falls from a point, but a new root comes through that point because there will be stem cells below the level of skin which is going to keep on regenerating new roots. So it doesn't leave that area empty. But in balding, if anybody has noticed, the hair balds only from the frontal area to this area. 5 cm above attachment of the ear behind that area is permanent throughout life. The reason is because the hairs in that area cannot be attacked by hormones. But if there is a genetic tendency for balding, you inherit receptors for balding in the area from front to back portion to which male hormones can attack and cause thinning of hair. So it's mainly because of hair sitting there and thinning that balding occurs. So hair becomes thinner, finer, lighter, smaller, it becomes like a baby root and finally it disappears from the surface of skin. Now how do we go about treatment? Basically the problem is genetics. Now there is no medicine which is going to 100% arrest balding. Balding can be only prevented to a greater extent or it can be delayed to a greater extent. Whatever medicine is there in the current scenario can stabilize around 70 to 80% of balding. But 20 to 30% in spite of using medicine, the balding is going to be progressive. So the person can get bald in around 7 years by using medicine. It can be pushed to at least 13 to 14 years. That means the existing hair can be retained for that. So basically the treatment is going to be like watering a plant. As long as you water the plant sustains. So if somebody asks me, how long should I use medicines, doctor? I would say as long as you want to retain your existing roots. Now, what about the thinning hair? So what happens? Where do we do regrowth? Regrowth happens through procedures like PRP. PRP means platelet-rich plasma therapy. For example, if we have a cut wound in our body heals because of cells called platelets. So in PRP therapy, from the patient's own blood, that is we take out around 20 ml of the patient's own blood and concentrate the platelets to 5 to 6 times the normal concentration. These concentrated platelets are taken out in a vial and injected back to the scalp at the level of the root. So what does it do? It rebuilds the volume of existing hair. It makes a thinner hair volume thicker at least by 25% and that increases the coverage by around 50%. Now if the follicle is totally lost from the scalp, that is especially over the frontal area where the hairline has receded or there is an empty space in between the thinning roots, PRP, even if we inject, there is not going to be any hair stimulation from that point. That area requires replacement and that's where hair transplant comes into play. So medicine is mainly for retaining, PRP is for regrowth and replacement is by hair transplantation. Now there are two types of hair transplantation. One is follicular unit transfer and one is follicular unit extraction. The previous technique which we used to practice is follicular unit transfer. In that it's a surgical procedure. We take out a strip of skin from the permanent zone. So where are the permanent zones of hair? In the back of the scalp where the hair never goes, beard roots as well as chest. But mainly this transfer technique, we take a strip of hair from the back area, then dissect out the follicles under a stereo microscope and these dissected follicles are placed into slits made on the scalp according to the angle in which we want the new roots to come out. Now the implantation technique for both the follicular unit transfer technique and follicular unit extraction is the same. In follicular unit extraction, we take out intact follicular units using a machine from the back of the scalp. Now this is the latest technique and everybody prefers this because relatively it doesn't leave any scar like the follicular unit transfer technique where there is a thin line C-shaped scar on the back of the head, and in follicular unit transfer there is also a pain post the surgery. At least 2 weeks post the surgery definitely there will be a bit of discomfort. In follicular unit extraction the patient experiences no discomfort. They can go back to work right on the next day itself and they'll be very comfortable throughout surgery also, and 5 days post the surgery nobody can make out that even hair has been taken out from the back area. Now, in this technique, we take around 4 to 5 hours to take out a graft of 1500 follicular units and implant it. Now, if there is a 3000 graft requirement, it takes around 6 to 8 hours. So, definitely it's a time consuming process. The number of grafts is determined by the area of balding also. If it's just a side angle elevation, the number of grafts required will be much less. But if the balding is from frontal to back area or the posterior area, then we might have to divide it into 2 sessions, and we usually prefer covering the frontal area because that gives a change in appearance or a cosmetic appearance, or when a photograph is taken, the person will have a good adequate density in the frontal area. Now, the most common questions we get is it painful? No, it is done under local anesthesia. It is not a very painful procedure, like how the tooth extraction is done, a small injection of local anesthesia. One line we inject to anesthetize the skin. And second thing, can we go back to work? So most people do go back to work the next day itself. If they are not comfortable with people knowing that they have undergone the transplantation procedure, then it is better to take around 1 to 1.5 weeks off, but there is no bed rest involved in this. Some people ask, can I travel post surgery? Yes, travel is possible post surgery, even on the same day as the surgery. And also, can transplantation be done in women? Yes, that is also possible, especially sometimes women might not be happy with having a high forehead, or there can be thinning of hair in the frontal area. So what we try to do in that case is to give more coverage over area which requires density. Now, in females, they won't be okay with trimming the entire scalp hair to take out the hairs required for transplantation. So we create a small window in the posterior area. We leave the hair up and down intact and create a small window and take a few follicles from different positions diffusely. So in females, we don't do an extensive transplantation. In one session, we might take around 1000 to 1500 roots and implant it over an area where it is most cosmetically required. Now, post the transplant, usually we advise spraying of the grafts, and the regular medication given are around 5 days post surgery. The regular anti-inflammatory and antibiotics are what is given. After that, 5th day post surgery, we allow the person to take a head bath, and head bath is used, froth of the baby shampoo is used for taking a head bath, and the regular medicines post the surgery are started around that period of time. The medicines, whether it is surgery or an option is platelet-rich plasma therapy, the medicine is same because that is the mainstay of treatment. There will be a serum to help the existing hair stay there, and also a tablet to help to stabilize the thinning process. So even if a person undergoes surgery, why we advise medicines is because only the transplanted hair is permanent. The existing hair is still under the influence of hormones, and the genetically susceptible hair can still progressively thin. So to match or balance out the effect of the transplant, the existing hair should also be retained, and for that the medicines are necessary. The regular hair washing with the chemical free shampoo can be started around the 2nd week post the surgery. Thank you all for your patient listening.